considered abortion in that situation. Every child is a gift from God, and again, every child is a wanted child.
The bill also requires women to make multiple trips to a clinic. They must first view a fetal ultrasound and hear the heartbeat at least 18 hours before an abortion. And it requires the mother to pay for the fetus to be cremated or buried. Opponents say the measure adds stigma, shame, and unreasonable barriers to a legal practice. A group of them showed up at the State House this week to deliver a petition with some 2,700 signatures opposing the measure.
There is no question that there are provisions in this bill that greatly impact a woman's ability to access abortion, and it's government intrusion into what should be very private medical decision-making.
If approved, Indiana would join North Dakota as the only states to ban abortions for genetic abnormalities. Ines Ferre, Al Jazeera.
Sue Ellen Braunlin is the co-president of the Indiana Religious Coalition for Reproductive Choice, joining us from Indianapolis to discuss this proposed law this morning. Sue Ellen, good morning, and thank you for your time. Much of the support for limiting abortion access comes from religious groups. Are there many faith leaders in your coalition that are for a woman's right to choose and against this bill?
Yes, actually our coalition is for reproductive justice. And there are many denominations who have signed statements that they support families' abilities to make their own decisions about how to plan their families. It is a huge commitment to parent, and we support women and families in doing what they need to do to take care of their families.
Constitutional issues aside, you make an argument for why this bill is actually not moral. Can you please explain that further?
It will raise infant and maternal mortality. It will incur suffering of babies. There will be more competition for the scarce services that there are for people with disabilities. And these are such a stress on families, and it disrupts families, it bankrupts families, and it disrupts parenting of existing children.
Let me just parse that out, what you said just now a bit. How does it increase infant mortality?
Because there are no services provided to care for these children, and more children will be born with disabilities, severe disabilities, not just Down syndrome, but any disability or potential disability.
So is what you're saying is that this law sort of addresses what advocates of it perceive as life before the birth of the child, but doesn't really consider what happens to the child after he or she is born?
That is right.
Many,
and, it is not, yes.
Yeah, go ahead, Sue Ellen.
A lot of diagnoses are just a destiny of suffering, and that has not been weighed into the moral equation on this.
And so it's not even just about Down syndrome. The focus has sort of been on that this would prevent women from making the choice to have an abortion if it's specifically because they have a child that in utero has been diagnosed with Down syndrome. It also applies to diseases such as Tay-Sachs, in which I understand the baby is born relatively healthy but deteriorates really quickly and has a strong likelihood of dying before the age of 4, correct?
Yes, with lots of suffering.
A lot of states, as you know, have started to pass bills that restrict women's access to clinics in these sort of indirect ways. What other aspect of this bill in Indiana is extreme in your view?
The requirement to bury or cremate embryonic or fetal remains from a miscarriage or an abortion is something we just haven't seen before. It's surveillance of miscarriage.
What do you think that is intended to do? Is that supposed to put an economic burden on mothers? Is it meant to shame them in some way?
All that, and I think keep track of them. And it opens the possibility of investigating miscarriages that seem suspicious to a provider.
Do you think that this bill, its terms could actually be enforced? For example, the bill requires that doctors refuse abortions, again, to women who elect to have them because of a fetal abnormality. But couldn't a woman just say she's electing an abortion for a different reason, not covered under the bill? And an abortion provider could certainly get around reporting the real reason, couldn't it?
Well, then you have doctors forced to lie to patients and doctors encouraging patients to lie to doctors. It really is very hard in these terrible situations to be trying to figure out what your doctor really is trying to tell you. It violates informed consent.
Sue Ellen Braunlin, thank you so much for joining us with your opinion on this issue this morning.
Thank you for having me, Stephanie.
When we come